I'm sure all the participants are there. So let's go over the screen.
So if you're ready, I'll start the proceedings.
Sure, go ahead. You can start. Yeah.
A very good morning, one and all. I wholeheartedly welcome all the participants to this national webinar on pharmacy career opportunities in the United States of America. I would like to say this can be called as the need of the hour. Irrespective of whatever the R it is always the need of the hour. And United States of America is one country where the scope for practicing pharmacy has got wide applications. So in order to have a more understanding about what are those opportunities and how one can have good access to those opportunities, we are carrying out this webinar today, and we have an eminent personality with us to take us through this talk. Without any delay, I would like to introduce the speaker of today's event. I would like to welcome Harsha, who completed who completed his bachelor's in pharmacy from JSS College of Pharmacy, Mysore, then obtained MBA degree from Osmania University, Hyderabad, and later on completed his PharmD at Roseman University, United States of America. Later, he performed different roles of pharmacy technician and pharmacy manager at New York and California, and currently he is involved for appropriate budgeting, human resource management, marketing, purchasing, control and security of all drug products across the country. He is also an expertise in the area of medication therapy management, and he is also involved in medication counseling, monitoring and evaluating of quality and effectiveness of patient care provided by the pharmacy staff. With this brief introduction, I would like to hand over the platform to him so that he can carry on the session. Sir, please.
Thank you, Raghav, for the introduction. Welcome everybody for the seminar. I would just take a few minutes, and I just want you to understand what it's going to be for the next few minutes. What I'm going to talk about pretty much is about any kind of opportunities. I'm sure people will have questions about other countries and everything. I don't want to talk much about it because I don't have much knowledge about it. I'm going to be honest with you guys. Anything about regarding USA and anything about pharmacy careers in USA, I can be of a big help, and I can answer your questions. And this particular PowerPoint I'm going to show you will answer most of your questions, and it would be of good help. So let me go ahead and share my screen. And at the end of the presentation, you'll have time for your questions and everything. So a couple of requests is one, please make sure to mute your screens, so that way I don't no disturbance for others, and wait for your questions until the end of the thing. So these are a couple of requests, and after that, let's dive into the presentation. Okay. Okay, I just shared the screen. I hope you guys can see the screen. Okay, great. Okay, if you guys can see the screen, do you guys see the cameras as well? Or you do? I cannot hear you, Raghav, sorry.
Yes, we can see the screen.
Yeah, you can see but do you guys see the camera? Can you guys see the faces as well, or just the PowerPoint?
We can see your face, and we can also see the PowerPoint.
Okay, so okay, great then. Okay, if that's comfortable with you guys, I'm going to go ahead and start it. Okay, this is about, as I said, it's pharmacy careers in USA. And when I say pharmacy careers, it includes everything from a retail pharmacist to all the way from like teaching and research, every single thing that's possible out there. So let me go to the next one. So just a brief introduction, just what Raghav said pretty much about me. These are the things that I have performed prior to becoming a pharmacy owner myself. Currently, I'm the owner of a couple of pharmacies in this country and in the state of California. Before I became a pharmacy owner, I have done multiple roles in big companies. There are Fortune 500 companies, and one of the biggest pharmacy chains in USA. Well, I would say, but because Safeway was in California, but Albertsons and Company was in the entire country. So they just go by different names in different states. So that's a little bit about me. And then I have performed as a manager, technician, everything. Yeah, pretty much what Raghav summarized. And coming to the pharmacist, I would like to say, first of all, you guys, because you guys are doing PharmD or any other pharmacy related things in India, I would like to say what are the things that you need to do at first. So, in order for you to in order for you to acquire a pharmacist license in America, you need to have TOEFL, and TOEFL should have different scores in different reading, writing, speaking, and listening. So there is a minimum score for each and every single thing, and you have to attain that in order for you to be eligible for FPGEC, which is Foreign Pharmacist Graduation Equivalence Exam. I mean, I might have said it wrong, but that's what it is. FPGEC is the exam. And after the TOEFL, with that scores, you can get the FPGEC like a approval for writing the FPGEC. And once you write the FPGEC, that kind of puts you like equivalent to other, like, your PharmD is equal to the PharmD that happens in America. But just a tiny exam. You guys do PharmD there. It's fairly easy. It's not that hard, especially when you do PharmD in India. And I'm going to be 100% honest with you guys. That is, if you do PharmD in India, like, it's piece of cake of most of the exams that you do here. That's what I felt, at least. I wasn't I wasn't a plus student in India, but I was an A plus student in America, even without attending classes or anything like that. But because our curriculum that we go through in India is very rigorous, which actually makes you like, prepared for any kind of thing that's going to be thrown at you. And after you do the FPGEC, you can do either one of these exams, MPJE or NAPLEX. NAPLEX is the National Pharmacist Licensure Exam. That is for the entire country of USA. So where you do that, and after you do that, this is the weird scenario here. Unlike in India, is even though you have the national exam passed, you still have to have MPJE, which is pretty much state jurisprudence exam, which we also learned when we were in, which you guys are also learning in PharmD, that is jurisprudence. But only thing is that jurisprudence pertains to your laws and regulations in India. But whereas this one is mostly towards America. And when I say in America, every state has different rules. So you have to take a test. If you want to practice in California, have to take an MPJE exam for California. There is no national jurisprudence exam. But keep that in mind. Why? Because every state has different rules, and this is a vast country, and which makes a big difference in terms of what rules apply in what state. And compounding, when I say MPJE, there are certain levels of difficulty in MPJE. California, Florida, and New York tends to have the hardest exam for MPJE, even harder than NAPLEX sometimes. If you are in the state of, if you're planning to work in the state of New York, the MPJE, apart from the MPJE, you also have to take a compounding exam in New York. But whereas in California, it's a tough exam, but it's just a CPJE, they call it. You have to take that. And after doing, while doing it or after doing it, at least after the FPGAC, you can start your internship. You have to have about 1,500 hours, which comes up to about an year. You can do that 1 year of internship in any of the retail pharmacies, clinical pharmacies, or hospital pharmacies, any of those things, and acquire those 1,500 hours with these 5 steps. It sounds a lot, but TOEFL is a very basic thing even to come to America. That's already there. FPGEC, as I said, it's a fairly easy exam, which you guys can take after the PharmD, and then which will make it easy for you guys for your entrance for MPJE and NAPLEX. MPJE and NAPLEX are common for everybody. Even if you do PharmD in America, you have to have MPJE and NAPLEX. So pretty much you guys are only taking one thing extra, that is FPGEC and 1,500 hours of internship, which even if you do PharmD in America, you have to do that. So it's fairly, everything is common except the FPGEC. So that's the only thing that you guys will be taking. just for getting a degree in India compared to America. But I'll tell you one thing though, it's a lot of savings when I say you doing PharmD in India, because I just tell you my personal experience. When I graduated from pharmacy school in America, my student loan was $200,000. If you convert into Indian currency, it's almost 1.5 crores. That's just the cost of 3 years of my PharmD degree, and which I'm still paying honestly. And if I was smart enough, I would have done my PharmD in India just like you guys, and could have saved a lot of money. And so that just taking one extra FPGEC is a lot better than $200,000 in loans, because you can buy a house with $200,000 in some states if you really look into it. So that's about how to get a pharmacist license. And once you get pharmacist license, you can get different areas, into practice. So once you become a pharmacist, there is a difference, right? What does a pharmacist do in India? It varies entirely different on what you do in America. So maybe the practice have changed by now, but when I was there, it's a little different. So mostly in India, like you go to a pharmacy, which is like an apothecary, medical shop, whatever you call it there. You go there, and then you pretty much take your prescription, give it to the doctor, give it to the pharmacy doctor or pharmacist, and then you give it to the pharmacist, and you ask them, I'm looking for these medications, and they're pretty much they look at it and then they give it to you. That's the fairly simplest job that they do. But here it's a lot different. Here the pharmacist actually has to put it in the computer, and every single person has to have a profile. And when I say profile, your date of birth, your allergies, and everything needs to be in there and your profile. And these are the things that pharmacist always monitors. So when I monitor your allergies and the prescription you got, let's say you're taking amoxicillin and you're allergic to amoxicillin, a pharmacist catches that and then stops it right there, and then gives a call to the doctor and then kind of fixes that. And it's not like in India. Most of the times, the difference in practice. This is what I'm trying to explain. That most of the times in India, you go to the pharmacy and you get the drugs within like about a minute or two, maybe 5 minutes. In America, 99% of the times, you will have to wait about 30 minutes. So the 30 minutes is for making it safe for the patient, and that's why the value of healthcare is a lot higher in America, and also the cost of medications is higher. The pharmacist pay is higher. Everything is higher. And when you put this into the computer, and you're not just asking the patient for money, but you put it in the computer and you process it through the insurance. And when you process it through the insurance, then there is a insurance pays certain part of the amount. Like, if let's say amoxicillin, if it costs $5, insurance might pay $4, and then they want the patient to pay $1. Or sometimes they pay the entire thing, and then the patient has zero copay. So that is an entirely different thing. It is hard. Not impossible. It just takes a month for you guys to learn, barely. That's why those 1,500 hours that you're going to be putting in as an intern would greatly help in this area, where how to build the insurance, and every insurance is different, every insurance codes are different. All these things you'll learn within that 1,500 hours is quite a lot. That's almost 10 months of rotations, internship. You wouldn't need that much. 1 month would be more than enough, but again, I'm saying, that will put you in the right path. And when you are also choosing the practice of a pharmacist, you can also choose the state. When you have the opportunity to choose, I'm not saying you have to choose. When you have the opportunity to choose the right state, because every state is different. Like an example, if you go to state of Utah, there is no limit for a pharmacist to have pharmacist techs. Which I mean is, pharmacy tech is something, a clerk or somebody who's working under you to help you out do stuff like you filling or billing, typing, everything. They do pretty much everything, and in the end, you check and you talk to the patient and you check the interactions. So when I say that, if you come to state of California, there's a one pharmacist on one tech, and if you go to state of Nevada, one pharmacist to three techs, and if you go to state of Massachusetts, one pharmacist to two techs. Why am I emphasizing this so much? So as a pharmacist, you worked so hard to become what you are right now. So you want to have a little bit of a relaxed life. You don't want to be working everything. You don't want to be the person typing. You don't want to be the person filling. You don't want to be the person checking. You don't want to be doing everything. You're there for your smart work, not for your hard work. So picking the right state will make a big difference. That way you have enough help to help you out. Because if you are in a state where there is less help and you're doing a lot of work, then it's kind of drags you down, and then it tires you. So choosing that before you become a pharmacist, that way you can take the right state's MPJE jurisprudence exam. It makes a big difference. And every state has different clerk to tech responsibilities. Certain states allow the tech to only a tech can type the prescription. Certain states allow a clerk also can type the prescription. So if they can take care of the typing, insurance, billing, and all that, you're already less on you. You're pretty much looking for any interactions and all that. So in California, there's only one tech to one pharmacist, but a clerk can type, and you can have 10 clerks, and then all those clerks can type, and you can have comes a couple of robots, and then they fill, and then a tech can fill, and then you can just do the brain work. So that's why it's a very important what you choose, which state you choose. And there is no such thing called going there and buying whatever you want to. There are certain medications that are scheduled as over the counter. So when I say over the counter, it's purchased by the patient with the recommendation of the pharmacist without a prescription. But 99% of the medications do need a prescription. Antibiotics, psych meds, like even antacids, even pantoprazole, omeprazole, basic prescription from the doctor. Doctors rely on the pharmacist a lot in this country, whereas in India, pharmacists rely a lot on the doctors to get the business from the doctors. But here it's quite the opposite. I mean, we do rely. I mean, don't get me wrong about that. We as a pharmacist do rely on doctor to send some business, but doctors do rely on us quite a bit compared to other countries. Here, doctors will call you and ask you, "Hey, what should I give? What should I recommend? What should I write this patient? What should I dose this patient?" And the doctors appreciate that, and we are the people who are the power of for the any kind of math involved in dosing a kid or dosing anybody. So doctors are not that. I mean, doctors are smart. Doctors are not that smart compared to us when dosing a medication. In this country, they are good at diagnosing, but not at dosing. So dosing is our specialty, and we are the people who has the power of dosing a medication. And then they always rely on us. And the more you help them out, the more appreciation they'll have for you, and then the more like a relationship you will build with the doctor. And everywhere when I say billing, insurance, putting it in there, I mean, putting the patient information into the software and all these things can be done using a software. And every place has a different software. It doesn't have to be the same software across the board. So always remember, the software that you use also makes a big difference. I mean, every company has a different software. So when you're choosing a job, let's say you got a job at CVS, Walgreens, these are the big chains that are in America. So make sure you pick the job where you have that better software, which makes it your life easy, which has the better ratings and stuff, which makes a big difference. And also robotics, which I talked about, pill counters. Pills are counted here. Pills are not in the bubble or strip pack like in India. So make sure you can find a pharmacy where you can they have pill counters or robots which can help you out. So that will make your life a lot more easier, because as I said, no hard work, more smart work. So these are the ones that you will learn when choosing a job. And as I said, this is the difference in practice. We don't use robots in India. We don't use a soft. I mean, I'm sure that they use a software now, but not a software to bill. So these are the differences that we have from Indian pharmacy practice to American. And this is the diversity in the pharmacy. So okay, we're talking about all this retail stuff where I have a medical shop, because that's the most common thing that we see in India. That's what I wanted to start it with. But apart from that, there's wide varieties of opportunities as a pharmacist in this country. That is, you can become a hospital pharmacist. What is the difference between a hospital pharmacist and a regular pharmacist? When you're a hospital pharmacist, it's not like in India where there is a pharmacy in the ground floor, and then you go and then pretty much get the same medications and stuff outside. No, it's not the scenario here. When I say the hospital pharmacist, which means when the patient is on the bed, so all the IV medications and everything has to be mixed, including the, I mean, in India, a lot of nurses do that, including the IV bags, and everything has to be done by the pharmacist, checked by the pharmacist, dispensed by the pharmacist to the correct bed. And then once it's gone there, that's when the nurse administers it. Unlike in other states, other countries where nurses do most of those things. That's another thing. And also, hospital, when you're a hospital pharmacist, you will be going on rounds with the doctors to check the patient's med profile, and then patient's I mean, any kind of illnesses, everything. You will be walking with the doctors, and you will be making the diagnosis. And you will be helping them the right medication, picking the right medication, right dosing, and all that. And there is long-term care pharmacies. Long-term care pharmacy is nothing but let's say elderly people who are at this after certain age, most country, most of the people try to live independent, which means they do not rely on their kids to take care of them. So they have their own long-term care facilities. So where they live in those facilities, when they live in those facilities, uh, the person who's taking care of them is not authorized to give any medication they want to. What if they're trying to steal their medications? What if they're not giving the right medications? And how these things are controlled in this particular long-term care facilities is a pharmacist packs all these medications in a bubble pack. So just like our blister packing in India. But let's say if a patient is taking three medications or four medications in the morning, two medications in the afternoon, six medications at night. So you pack them in that blister pack, three, two, and six. Excuse me. So when they pack it like that, so what happens is uh, the morning they punch one out and then give all those four. Afternoon, punch those two out, give all those two, and then six. And these are called the medtechs. And these medtechs are not allowed to do whatever they want. They only follow the directions and the directions that are on the label to give one pack to the patient. And that's
I'm
where we
sorry
come.
to disturb you. I'm sorry to disturb you.
Go ahead.
It's so unfortunate that sometimes we are getting a loud amount of disturbance, which is actually
Oh,
happening with your voice.
oh, shoot, sorry. Let me see what it is. Can you hear me now better or no?
I would like to say whenever you make any kind of movement, the disturbance is growing bigger.
Okay, you know what? Let me see. Maybe it's. Can you see it right now or no?
Yeah, right now it's fine, but somewhere in the middle, the moment you make some kind of movement, we are getting a disturbance, which is actually overlapping with your voice and making it difficult to follow you.
Okay, next time you hear it, stop me, and then I'm gonna try to maybe change the room or something. Okay.
Okay, sure. I'm
Okay.
sorry.
So
Please
as
continue.
soon as you hear some kind of disturbance, let me know. Stop me right then and there. Okay.
Thank you. Thank you.
No, no, no problem at all. Thanks for letting me know. Thank you. So that's long-term care facility, and where you can punch out those bubble packs and then give it to the patient when they need it. And how that's how medtechs will be cross-checked when they get an audit or something. So let's say if they come in on the third day, which is now February 3rd afternoon, and then the medtechs is getting audited, right? So when they get audited, they check out the patient's list, and then see like, hey, you know what, the patient was supposed to have 3 days worth of bubbles popped out, and then on the third day half of it is popped out. And then they check that, and then they're like, okay, you know what, the medtech is doing their job right. And that's how the audits are done, and then they keep it clean for their elderly people. And then retail pharmacy, as I talked to you about a minute ago, which just like in India, but only thing is billing software, and most of the things are filled right then and there, and checked for interactions and all that. That is the retail pharmacy. And there is nuclear pharmacy. And nuclear pharmacy is also certain kind of a retail pharmacy, but mostly in collaboration with hospitals when cancer patients need the isotopes for them. So these are also compounded in a nuclear pharmacy and then dispensed straight to the hospital for injection to the patients for the cancer therapy. And infusion therapy, it's similar to nuclear, but only thing is in nuclear you use isotopes, whereas in the infusion pharmacy you use mostly the antibiotics, TPNs, total parental nutrients, and all these calculated and dosed to the patient, especially when we want to lower their hospital charges. In America, hospital charges are ridiculous. I mean, like, it's too high. So I can give you an example. If somebody goes into an emergency room, probably their visit will cost them $3,000. Somebody gets admitted into a hospital, per day their charge would be almost $8,000, 5,000 to $8,000. So how can you avoid those costs? Is the doctors try to discharge the patients after a couple of days of visit, and then at home, what they would do is give them the infusion pharmacy address and prescribe them what they need to get from the infusion pharmacy. And the infusion pharmacy takes over from there and then does the antibiotic therapy, total parental nutrition, or any kind of dialysis treatment that they need straight from the infusion pharmacy. They compound it there in the IV bags and send it to the patient's house and send a nurse over there to take care of that. And then we coordinate with the nurse and the patient, so that way the patient gets the needed treatment straight from the home at a lesser expense than being at the hospital. And there is geriatric and pediatric pharmacist. So this is for elderly and babies, and this is usually in the hospitals. And there is a neonatal pharmacist, which I did not mention here. These are also the pharmacists that they take care of younger babies and older people. I mean, different kind of pharmacists. So elderly people needs dosing differently than a regular healthy 30-35-year-old person. So that's different dosing that a geriatric pharmacist does. The same way pediatric pharmacists, younger babies and all that, under the age of 2, you cannot go to any pharmacy and get the regular stuff unless you have a prescription. And when you get that prescription for the people that are under the age of 2, is actually done by a pediatric doctor with the collaboration of pediatric pharmacist at the hospitals. That's another thing. Ambulatory care, this is usually in the hospital, but same thing, the way we talked about, the IV bags are compounded by the pharmacist. Instead of IV bags, if there is a oral medications that they need to take, that's done by the ambulatory care pharmacist, just like any tablets or pills or anything. But usually it's only done in smaller packages because patients are not going to be staying in the hospital for longer than 7 to 10 days or something. So it's only done, everything is done in 7 to 10 days, and lower the cost for the hospital, lower the cost for the patient by the ambulatory care pharmacist. And there is compounding pharmacist, which we do at our pharmacy too. A lot of elderly, not elderly, I would say about 40, 45 women, which is very common for any men or women that is having reduced hormone levels. So compounding pharmacist that's what we do. We compound creams, lozenges, and pills to match the reduction of the hormones in the person's body at that particular period of the time, which is at 40, 45. The decrease in their hormones, we try to get bioidentical hormones compounded in the form they want. If they're comfortable with capsules, tablets, whatever it is, and then mix them and then give it to them in the right dosage. I mean, you might ask, why not get the pre-filled tubes or anything like that? When we say bioidentical, we want to match it to the person's body as close as possible. So that way, less chances of cancer causing, because hormones tend to cause cancers and blood clots and all this. So which can be avoided when you compound the pharmacy, when you compound at the pharmacy. And also when you compound, their expiration date is lower. You're mixing it right then and there. So you have a shorter window for the person to use, and the chances of side effects decrease at that point of time. So that's why we use compounding. Compounding pharmacies is also a big role in this country. That's one other pharmacy sector you can go into. And apart from that, let me see, it's another next slide. If not, okay, apart from that, there is teaching. You can be a teacher, you can be a professor in any of the pharmacy schools, and or you can pick any of the expertise that you get from pharmd, pharmacology, chemistry, uh, anything, any one particular aspect of it, and you can become the professor in that, or teaching in teaching. Industrial pharmacist, which is the most common thing that we see in India. That is, you can work for any industry in different kind of areas, from R&D to compliance to pharmacovigilance, any of those areas, you can help the companies, I mean, in the industry, to promote any product that they're going to come up with, or in the manufacturing, distribution, to any of these areas. And call center pharmacists, I mean, they are getting bigger and bigger now, especially with the COVID. People have questions about their medications. There are quite a lot of pharmacists that are sitting in their call center in America, where they just pick up the call and then help their patient with how to take their medication, and what side effects they can expect, and what are the things that they need to follow when they take these medications, in order for them to get the better results. And drug information. So, like an example, in America, we have to give drug information every time we give a medication. So, let's say you give finasteride to a patient, you have to give their drug information. And these all drug information is collated and formatted by a pharmacist in the back end. So there's billion drugs, so which means there's at least 100,000 jobs right there for just drug information, done by multiple pharmacists, which includes all the testing data, side effects data, and how to take it, all that information in there. Clinical research, there's quite a lot of research into new drugs, which is also which is also you can jump into. Pretty much industrial pharmacists, but not into manufacturing, but mostly into research. And then MTM, this is medication therapy management, which is peculiar mostly in America. Is like how can we avoid a person who's elderly getting negatively impacted by long-term non-taking of their medications, not staying adherent to these medications. The point of doctor writing your prescription is so that you take it and you stay fit and you stay good with it. But when the patient does not take it right, the adverse events will be far bad than if they take it. Like an example, I would say lisinopril. So lisinopril, if the patient takes it every single day, it has mortality benefit, where it not just prevents the blood pressure, it also helps the heart healthiness, and which in turn increases the livelihood of the person and decreases the amount of other side effects, like affecting the kidneys, affecting the heart, reduces the stress on the heart. So how can you do that? A medication therapy pharmacist can put the adherence onto the patient. Like how they call the patient every month and check up on them and make sure any of these inexpensive, good medications that can avoid them a hospital visit. A pharmacist can do that, and that's medication therapy management. And then also going over their medications once a year, and then making sure there are no interactions. Yes, granted, every single day the person that's filling is checking that, but apart from that, like an example, you go to 10 different pharmacies and get 10 different medications, the other pharmacist might not know what you got at the other pharmacy, but your medication therapy management pharmacist does know, because he has the profile of yours with every single thing that you ever got from every single pharmacy, so they can avoid those mishaps from happening, and then avoid the interactions and increase the livelihood of the patient, and avoid also their hospital visits. And pay scale varies. Pay scale is a big thing. Obviously, one of the big reasons anybody chooses one degree over the other. One of the reasons, not all the reasons. One of the reasons is pay scale. And when I said all these diversities of pharmacist jobs, you can pick one over the other depending upon your pay scale too. So there's like an example, a retail pharmacist makes quite a lot of money, and industrial pharmacists and clinical research, if you are in the highest level, you do make a lot of money. But usually what I have seen is in America, retail pharmacists tend to make quite more than anybody else as a start. But when it comes to other pharmacy professions, over the period of time, if you're true to it and if you work hard towards it, I tend to see that people have seen tremendous growth in their pay scale, and also in their hierarchy of job level. They can grow up the ladder very easily in other areas because of less competition. And also, let's say if you pick a hospital pharmacist, you can just start as a hospital pharmacist, and almost become the TNP member, like, which means therapeutic council department, where a hospital tries to put what drugs on the formulary. So, like an example, if you go to any hospital, not every hospital will have every single drug that's available in the market. They only have certain medications that they think are good for their patients and they're economical. So that way they can keep the cost down and inventory down for the hospital, and as well as the cost down for their patient. And this PNT team is usually ran by a doctor and a pharmacist and nurses and all those departments. So you can be growing up the scale from just a regular pharmacist to all the way up to one of the people in the PNT team, which means a higher pay right there. So industrial pharmacists tend to have a decent pay, starting with more benefits, and pharmacovigilance. All these things also tend to have, but it just depends on how true you are to the career that you have chosen and how hard you're working towards it. There might be, you can become a clinical research person and then come up with a molecule or come up with a treatment, and you can make hundreds of millions of dollars overnight. It's just not what you start at, it's just what how true you are to the profession you have chosen and how hard you work towards achieving the goals. That will make, I mean, it's endless opportunity when you, if you're true to what you want to do. And the path, where do you want to start? And I don't know where to start. I don't know how to approach, who to approach, all this. I'm sure you all guys have all these questions. I mean, I know all these things are there, but where to start? What should I do? I mean, I'm here all the way in India. I'm just finishing up my PharmD. What should I do? I just don't know. So this is one of the questions I had when I graduated from India and became a pharmacist. So I hope, I'm guessing that you guys have similar questions. So I'm try to answer the best I can. And of course, after this thing, you can still ask me questions about anything that you have, where to start and everything. So when I say where to start, the first place, as I said, TOEFL. Start there, and then come to America. And you cannot come to America straight for a job. You can, but it's not that easy. So the easiest path, the easiest way to come is coming for a master's. So find a master's degree. Not that you want to excel in that career, but just pick a master's, the cheapest one possible, and that way you can come to this country. And when you come here, when you start the career, when you start the masters, while you're doing it parallelly, you can work in a pharmacy, or you can do FPGEC. You can do all of those exams, which a lot of my friends have done. You can do all of those things within the 2 year period of time, while you're doing the masters. Do the FPGEC, do the TOEFL, do the NAPLEX, do the MPJE, do the 1500 hours. You can finish all of those things, and by the time you're done with the masters, bam, you have the license, and now your time to apply for jobs. And here comes the thing: how to approach. If you want to approach for the how to apply for the masters in America, of course there are a bunch of consultancies in India you can reach out to, or you can check online. There's a bunch of resources. Which university you want to apply to, how do you want to apply, and there's application buttons, and you know it's how to apply, easy. You can find it in the websites. Most of the universities have a admissions category where you can find how to apply, and then you just apply for it and you come. That is for the admission as for masters in America. But after the masters and you finished all of your FPGEC and all those requirements, and you have a license, then how to approach for a job. Just like in India, here also you have a bunch of websites like Indeed, Monster.com, and ZipRecruiter, quite a lot. You can apply through them, or there are consultancies like RX Relief and bunch of other things. You can reach out to them. You can apply through them, or you can also apply through organizations. There are Indian pharmacist organizations, Indian pharmacist associations, and Indian pharmacist associations for every single state. You can reach out to them first, and then reach out to them and tell them that you have a license, and bam, they will post it on their dashboard. And once they post it on their dashboard, every state has bunch of pharmacies. There are states that with 3 to 5,000 pharmacies, and out of them, like 1,000 of them are owned by Indians. So when your visibility goes tremendously high when you reach out to an organization and make the organization post that you're looking for a job and you have a license. That's how you approach these things. And how to excel, which I talked to you about before. Stay true to it and stay honest and work hard. And there is no ifs and buts. This country is land of opportunity. I mean, I have came to this country 10 years ago, and today I own three pharmacies, and I'm buying. I mean, I have 30 employees, and none of this was pre-given to me by my parents or anything. I have started from zero. I have came here and I have done my master's. Done my PharmD. I have started working for a big company and then excel there. And then after that, I wanted to buy my own, and I bought my own pharmacy. And then now I'm buying more pharmacies, and I have bought more pharmacies. Only the only way you can do that is if you're true to it and if you work hard. There is no limit to what you can do. That's how that's how it works here. And then it's treated well. The pharmacist profession is treated well, and you are treated very respectfully in this country for the profession and for the service that you do. And who can you contact? Every single place that you want to contact, FPGC, all these random names I don't understand. If that's what you think, just type in Google FPGC, go into the website, and there are contact information for every single website. Naplex, contact. MPJE, contact. Every single thing has a contact page. Click on the contact, click reach out. They will take 24 to 48 hours, but they do respond. They do have the responsibility, that they have the obligation that they have to respond to each and every single email that they receive within 24 to 48 hours. Considering COVID, it might be a little late, but they will respond. So that's another thing. And you can always reach out to any of your preceptors, people that are graduated from your school, people that are already in America doing PharmD. Or you can always reach out to these associations and ask them, hey, I'm planning to do NAPLEX. How can I do? Can you help me out? Can you get me in touch with somebody who is working on the same thing right now? Can you get me in touch with somebody who just finished it right now? Something like that. So all these organizations are here to help. That's something you can look into. And in the end, is it all worth it? That just depends on totally on you. Because are you the person that are coming to America, want to be a pharmacist here? Yeah, it's worth it for you. Are you somebody, no, I want to be in India, I want to be here, I want to, like, it's not worth it for you. So make your priorities first. Don't jump in just for the money. Don't jump in just for the pictures that you see, all these tall buildings and all that. Do it if you feel like it, and if you can work through it, because it's not an easy program, right? It's not something like you did a bachelor's in IT in India, and then you come to America, and then you do masters, and then you get a job immediately. It's not like that. Why it's not like that? I mean, we are talking about 6 years of PharmD, right? Let's compare with a doctor. They do it for 6 years of doctors, and after that they have to come to America. They have to do USMLE, and then after USMLE they have to work as an intern for 3 to 4 years, and then they become a doctor. So compare the stress level. If you are in a healthcare field, it's not always about money. It's always about saving the patient and being that caring person for the patient. So if you can save somebody's life, yes, it's worth it, and you have the power to do so. And you have the power not just to save a person, you have the power to improvise the health quality of life for somebody. Yes, it's worth it if you think of it that way. But if you have different aspects or different aspirations to do something, then it might not be worth it for you. But it's not. And again, you're still young. You can decide it right now before you come to America or before you go to any other country. Is it worth it for you to put all those hours and everything in there? If not, you can choose another career. But that's what you have to make yourself before you make the choice of which country you want to go to, which profession you want to choose. Make that SWOT analysis for yourself. Which one is your strength, weakness? Which one is positives and which one is negatives? Check that out, and then figure this thing. That's what I said. And the next step, next point, which I was about to say, is the distinguishing factor. Those are your distinguishing factors. That's what will decide you. Like, do I want to go through all this NAPLEX, CPJE, MPJE, and all that? Yeah, if you don't feel like it, then you might be able to go to Canada. I mean, Canada does not even have all this. You only take two exams and bam, you're a pharmacist. But is the Canada pay scale the same as America? No, definitely not. And is Canadian dollar same strong as the American dollar? No, it's not. So these are the things that you have to consider. I'm not here to guide you on all that, but that's something you need to consider before you make the step of which country you want to go to. UK, Australia, whichever the country you, or America. Even when you come to America, which kind of pharmacist you want to become. You need to look into all these factors before you make that choice, and don't jump into something and try to change it. It's hard. It's very hard once you're in something and changing it. I mean, you're already, probably you guys are 22, 23, and if you're already halfway through pharmacy, now you want to change it to something. Imagine how hard it is. So imagine after this you invest 2 to 3 years of your time and become a pharmacist, and then you want to change to a different pharmacist career. It's not impossible, but it's hard. So might as well not waste the money. So think of those things before you make the decision. And what's next? I mean, like, that right now, depending upon which year of PharmD you're in, decide it. And then do not wait for the last minute. You don't have to be in the 6th year or finish the 6th year to work for TOEFL, NAPLEX, or anything like that. You can start it right now. I started my PharmD and everything, sorry, my GRE and TOEFL when I was in 2nd year of the pharmacy, and it helped me out in the end of the and when I finished it. So if it doesn't matter, maybe you're in the final year, maybe you're in the 1st year. It's never too late. If you prepare yourself, this is what I want, start as soon as possible. It helps you out. FPGC, NAPLEX, MPJE. I mean, I'm only in 3rd year. I'm only no. It doesn't work like that. It doesn't matter what year you're in. Preparation can be started whenever you want to, however you want to, wherever you want to. Because just because you're in India, it doesn't mean you cannot start. You can start preparing. Just because you're in 3rd year, no, you don't have to wait until you finish it. You can start. You can start right now, and whenever you can. You need books. You can look it up. Naplex books for NAPLEX exam books. There is something called RX Prep. There is something called Pass NAPLEX. These are the books on subscriptions you can get and start preparing for them right now. And it just makes your life easy when the time comes. Okay, and I think I finished my presentation. I hope you guys were able to hear most of it without the disturbance. And yeah, if you guys have any questions, go ahead.
Well, thank you so much for your presentation. And now all the students, you are given access to unmute yourself and ask your questions. Please do it one by one. So don't be in a hurry. He'll be with us for whatever time that he is having with us. So please go one by one.
It looks like no questions.
No. Actually, they are actually waiting for their time. Okay, fine. Before they ask something, I would like to ask a question which is widely discussed. So, as you rightly said, that after finishing their TOEFL or GRE or whatever, they come there for an appropriate master's degree. So during this master's degree, they have this opportunity to write these exams. So what do you think is the best course that they can select during their masters, which helps them either ways?
Nothing would help to become a pharmacist. It's my personal opinion. But unless they chose to go to industry or something like that, they can do masters in pharmacovigilance, or they can do masters in pharmacology. And if they want to go to the industries, in that case, they don't even need a license. And then they can just become a teacher, professor, and they can also become work for the industries and all that. In this case, they don't even need NAPLEX, MPJE, none of these. If they want to become the pharmacist and in the retail section, none of the master courses are needed. Their PharmD is well and good enough. But focus more on, my personal opinion is, focus more on finding something inexpensive. finding something that has TA, PA, like teaching assistant, or all these things where they can stipends, or any of these things that can help them to make their cost cheaper. And then when they are those 2 years, they don't have to work on other part-time jobs or go for money, which will help them pay for the school. If there is a stipend, if there is a TA, teaching assistantship, they might not even have to pay for the school. In that case, they can use that time on the internship rather than focusing on some part-time job to get the money to pay for the school.
So nothing like health informatics, nothing like
Yeah, I mean, if
community.
they're if they want to become health informatics, they don't need a pharmacist license. In that case, they don't need to write an NAPLEX or MPJE, nothing. They can just come in to this country for health informatics, do the health informatics, and straight go to drug informatics or health informatics. Straight go to job for health informatics. They don't need a license for that. They can do hospital admin, they can do that. I mean, the administration jobs, they can do those. None of these things need a license, so no need to worry about internship or NAPLEX or MPJE, nothing. They just do that masters and then just go for that.
Okay, I think I just need to reframe my question, because what I wanted to ask was, for a student who is aspiring to become a pharmacist in the United States, so he has to come there.
Mhm.
He has to do a master's program. Only after doing a master's program, then so he can clear that FPG exam.
No, he doesn't have to come for masters. It's just the easiest way to come to for. I mean, they can straight come for the job too. Though,
Okay.
so yeah, so masters is just a path easy to come to America, because the number of visas that they allow for masters is tenfolds more than jobs. So like like if you stand in the line for a job, the chances of rejection is for every other person in the line. Like probably out of 10 people, 9 people will get rejected and only one person will get the job. And after that, there'll be a lot of scrutiny and a lot of background check and a lot of things that they will check. But whereas student, nothing. You just walk right in. Out of 10 people, only one person will be rejected. And because even if you come for the job, you still have to work 1,500 hours as an intern to get your license. Might as well do it as a student, where it will be a lot more easier. Your chances of getting visa is higher, and then within that 2 years, you have enough time to work as an intern. Let's say if you come straight for the job at the internship time, they're not going to pay you. So how are you going to support yourself?
Yeah, and yeah. So since coming to US for masters is the easiest way,
Yeah,
so and then they have to do a program in masters.
yeah.
What would you suggest that students take a particular program in masters, so that it may help them during their clearance of FPG or anything like that?
I mean, that's I mean, it's a great question, but there's no right answer for it. The reason why I say that is because when you do PharmD in India, honestly, that is that is good enough. That is good enough to make them easy to take test. None of the courses that they pick for masters would help them for the FPGC, NAPLEX, or anything. None of them will help. Why? Because they are more specific to chemistry, more specific to pharmacology and all that. But whereas PharmD is more clinical and more towards patient oriented. So none of them would help. But I would recommend, if you want to do something in masters in chemistry or something, because masters in chemistry has a lot of funding in this country. Biochemistry, chemistry, these things have a lot of funding. So when I say funding, so the college gets funding for chemistry, the chances of getting TA is easy, the chances of getting a stipend is easy, so which means the masters is paid off for free. For
Okay.
that reason, it would be helpful, but not for taking the exam. Nothing other than PharmD by itself would help you for taking the exam.
Okay.
I hope it makes sense. I know it's a little vague, but that's just the way it is,
Yeah,
unfortunately.
I understood. I understood. Yeah. Okay.
Any other questions to anybody?
Yeah, I do have a couple of questions, but I'm waiting for these people to ask so that I can do it later for myself.
No, sure, sure.
So I request the students to please go ahead.
It looks like everybody's pretty good. I think the presentation answered most of the questions, it looks like.
Yeah. Okay, I would like to ask another question of mine actually.
Go for it.
So yeah, please go ahead if somebody is asking.
Hello? I think they might have mistakenly unmuted.
Okay. So the next question that I would like to ask you is, once somebody clears the NAPLEX exam,
Mhm.
is it difficult to get any residency internship in the hospital? Because I heard that it's not easy to get a residency or an internship at a hospital immediately after you clear an NAPLEX exam. You need to wait for some. You need to wait some. You need to wait for a vacancy at hospital. So it's not that easy. Immediately after clearing NAPLEX, you get a chance to do internship.
It is a little hard, not that but let me tell you this though, it is a little hard, but the best way to approach it is find a remote place in the sense, like an example. So let's say right now you're in Guntur, right? This school is in Guntur is considered as city. Like, so let's say if you go little smaller towns, like an example, I don't know, Sibar College, I don't remember the name of the area. So like if you go to that remote places, like in America too, if you're in New York, if you're in San Francisco, if you're in these cities, there's more competition. A lot of people are actually there looking for the same kind of internship that you're looking for. The best way to approach it is go to a little remote place, like an hour or 2 hours from the big city. Then there is more hospitals that are looking for people to work for them. So then you can easily get your internship there. Yes, it is hard to get, but there is a way to get around it, is going to that remote places. The farther you go, like an example, Alaska is considered remote in this country. You want to go, I mean, worst case, what, you're going to be there for 2-3 months, you go there, finish it in 2-3 months and come back. You can come back anywhere. So that's just the turn or workaround to get that internship. But it is hard, but it's not that hard. There is a workaround for it.
Okay. And the next question is the continuation of this. So once you are done with an internship, then when it comes to the job at a hospital pharmacy, now again, is it again hard? You need to wait for a vacancy, or how is it?
Just like doctors, most of the jobs in America, same thing. If you want to work in a hospital, yes, it is a little harder than the retail, because the number of hospitals in a town are maybe one. The number of retail pharmacies are maybe 10 or 20. So the chances of you getting a job in a hospital is less, compared, just because of the scarcity of it. It's not because nothing special about it. It's just the scarcity of it. So working in a hospital is because number of hospitals are less, so the chances of getting a job in the hospital are less. But same workaround. If you look at any kind of remote things, if you go 2-3 hours far from the city, a lot of hospitals are looking for pharmacists everywhere. So that way you can get the job very easily. And also, after the internship or while you are doing the internship, all of these hospitals provide residency. So even after PharmD, after pharmacist, we have residencies too. You want to become excellent in dialysis, you can become a dialysis pharmacist. You want to just become excellent in warfarin, you can just become a warfarin pharmacist. So a lot of hospitals provide that residency, and if you do the residency, it's very easy to get the job. But getting into the residency, it just depends on how good your rapport is with your professor when you're doing that internship. So getting that internship first, and then after that getting in good touch with your pharmacist or whoever your preceptor is there, and then if you get the residency there, it's very easy for you to get the job. But if you don't do the residency, it's a little hard for you to get a job in the hospital.
Okay. Uh, So I don't know whether this can be compared or not, but what do you suggest? Whether where do you think is more fruitful, either a retail pharmacy or a hospital pharmacy? First of all,
I
can be compared or not? I don't even know. I just want to ask.
No, absolutely. Absolutely, you can compare both. There is there is a high amount of scope in retail pharmacies, because just like in ours, like if you go in, if you're in Guntur too, you can compare how many hospitals are there and how many retail pharmacies are there. Like medical shops, we have every single place, right? The same way here also, you have a lot of medical shops, which we call pharmacies here. So you have a bunch of pharmacies, but the number of hospitals are less. So that way, when you apply for a resume, you have 10 openings for a retail pharmacist, but whereas one opening for a hospital pharmacist. That's where your scope goes down. And that being said, the best of all is when you're doing in the retail pharmacy, that is the highest paid than a hospital pharmacy. That's the best part in this country. That is, the more number of jobs are there for the thing that pays the most. So you can work as a retail pharmacist and you can make more than working for a hospital.
Okay. Um, I would like to ask you what made you buy one and what made you to expand that?
Oh yeah, for number one reason is when I was working for this big company there. I mean, this is just my personal opinion. Everybody is A lot of people are happy and safe and sound with where they work on a pay scale. But when I was working for them, one of the biggest reasons why I wanted to own my own was every day, every month, I get the profit and loss. So my company, the store that they have assigned me to, they have about 2,500 stores, just the pharmacies, 5,000 like Walmart kind of thing. But out of that, 2,000 of them inside that they have pharmacies. And out of that, they gave me one store. And this one store that they gave me, they did not see a profit in that store since 1986. And that was way before I was born. But since they gave it to me, I was always showing them profits every single year. And my boss was very appreciative of it. And then I was like, okay, if I can do this for my boss, why cannot I do it for myself? And then that's where the idea came up. I want to own my own. And also, I always had that passion inside me to give jobs. I'd always like to give jobs. I don't want to be in a position where I'm asking somebody for a job. I always wanted to be able to give jobs. So that's why I first bought one, and which, God's bless, everything was successful. And then I bought the second one, because one of the pharmacists who was working for me as an intern wanted to go to another town. He was a very good pharmacist, worked under me, learned everything with me. And then he wanted to move to a town where, not town, like a city. He's from Los Angeles. He wanted to go to Los Angeles and live with his parents. And then I was like, okay, if you're a good pharmacist, and I'll buy one pharmacy there so you can run it for me. Then I bought the second one there. And the same thing, one more pharmacist, he's also from India as well. The other guy, he wanted to move to another state. So I bought one other thing with him, for him, in state of California, all of these are, but in different city for him. So now he's taking care of the other one. So that's how I got expanded. But my reason to start is to give jobs, and the reason to expand is people that I trust, and people who are hardworking, wanted to own. I mean, they learn from me. They also want to own a piece for themselves. So in partnership with them, I was able to buy the remaining.
Okay. So a few of the students have raised their hands to ask the
Sure.
question.
Sure.
So I request the students to please make sure that your surroundings are not having any noise so that your question will be clear to the speaker. Please proceed.
Hi, sir.
Hi.
Uh, so actually, my question is that what is the exact process of going into research and development? Do you have any idea about that?
It's fairly easy. Honestly, if you want to go into research and development, is actually a lot more easier than becoming a pharmacist. So the easiest way is whichever the part that you want to be doing the research and development in, like chemistry or pharmacology, whichever the part that you want to do in, I would recommend doing the masters in that. And while you're doing the masters, network yourself. There are a lot of pharmacy companies owned by Indians here. There are a lot of
Mm-hmm.
pharmacy There are a lot of companies, there are a lot of Indians work in there. So if you're part of any Indian associations and all that, and then reaching out to these people and start your the contact process, outreach process as early as possible. And when you start it early, that way you can, by the time you finish it, as I said, there's a lot of companies owned by Indians, a lot of companies where Indians work in there. So you can reach out to them, and they're always looking for research and development, not just research and development, multiple areas. I have quite a lot of friends who graduated with me in JSS and came to America, and then right now they're working in multiple areas in multiple different companies, from Abbott to any, you name it. Most of the company, any company you name it, I have somebody that I know who are from India who came in here and then did their masters and then working there in different areas. So not just R&D, like manufacturing, NDAs, developments, all those things.
So, one master's in specialization is enough, or do we have to also clear the license exams to go into research and
No,
development? We
no.
don't
If
need
you
you.
No, if you want to do the R&D, you do not need the license. Let me make that clear. You do not need a license to work in any industry or any kind of R&D. You just need, I mean, you don't even need a master's. Master's is just a way to come to America, makes your life easy. And when you come here and you finish the master's, automatically you'll get 3 years of work permit. That just easier way, but you don't even have to do masters. If you say like, hey, you know what, my grandfather, my grandmother, my aunt knows somebody who owns a company or who works for a company and who can get me a job, and you can get it, go for it, get it, and then you can go apply for a visa. And if you can get the visa too, your score, I mean, you score. It's easy. But it's not that easy for you to find somebody who can get you a job straight, and it's not that easy for you to get the visa when you're applying straight for the job. But other than that, you don't need a master's, you don't need any of those. All these things are just to come in and make your life easy for the next 3 years, because it's automatic permit. I hope I answered your question.
Yes, you have. Thank you so much.
No, no problem. No problem.
Hello.
Hello.
Very good morning, sir.
Hi.
Sir, I am Rahmatullah Sheikh, an intern in Doctor of Pharmacy. I think you have already answered the question. The question is an extension to previous question, like what is the exact scope of clinical research if we opt for MS, like scope of clinical research or regulatory advice if we opt for masters in the United States?
There is a lot of scope, research and development. As most of they spend quite a bit of money in research and development here. There is a lot of scope. 110%, there's quite a bit of scope. It's just the fact that as soon as you come, you finish your masters and then start looking for your networking. That's it. Or go for a consultancy, and consultancy can find you the job that you're looking for. That's it. And there is a lot of jobs. There are a lot of jobs, and there is a lot of opportunity, and there are a lot of jobs. It's just what you like, and then how you network with the right kind of people. Like an example, you talking to me, just saying, you kept on talking to me for the next 2 years, and you ask me for a job in research, I might not be able to give it to you because I'm on the retail side. But if you network with the right people, which is after you come to America, join the associations and everything, and there are research associations too. Join those associations, join those WhatsApp groups, and keep talking to them. And by the
Yes,
time you finish it, they would be able to get you a job right after.
thank you.
Okay. Did I answer your question?
Morning, sir.
Yes, sir. Yes, sir, you answered the question. Thank you.
Okay.
Morning, sir. I'm Soumya, sixth family.
Uh-huh.
So
Yes,
my
Soumya?
question is, what do you think are the job opportunities available in case of MS in public health services and healthcare administration?
Wonderful question. Uh, a healthcare administration has a lot of scope, but also a lot of competition. Why I say that is administration is usually an American thing. They're big into MBAs. If you see most of the people, the research and the science part is usually taken care by Indians and Chinese and all that. We take care of most of that. But when it comes to administration, is usually they are really pros at it. They're really good at it. Again, It doesn't mean that you don't have a job, but it's more competition for healthcare administration. Or whereas public service, yes, there is a lot of opportunity for it, especially right now with the pandemic and everything going on. There's a lot of funds that are put in towards the public service and public service awareness and in public health, where the immunization and everything, and educating people in terms of getting vaccination and then preventing it for prolonging the things and prolonging, I forgot the word, how to not contaminate other people as well. So there's a lot of funds going on into that. So there are a lot of jobs available. And now that it's Biden's administration, they do actually invest quite a lot of money in public health. So there is a lot of opportunity for it.
Yes, sir. Thank you.
And you can do masters in that if you want. You can do masters in public health, and then right after that you can do intern in any of the public health jobs, and then you can actually grow right through that. You do the internship, and you might even get hired right then and there.
Yes, sir.
Mhm.
Another question that I would like to ask you is, uh, uh, I think every time the election goes in US, the first thing that we think about is this H-1 visa. So who would be
Yes.
picked, who wouldn't be picked? So students who come to US on their student visa, so they complete their masters, and after completion of their masters, they will be in the pursuit of clearing this NAPLEX and working for their internship, etc. So what do you think? Because if I'm not wrong, student visa will be given only for a limited period of time, and after
Yeah.
that, in case if this part of preparation of NAPLEX or doing this internship falls beyond that, so is there anything that you'd like to clear on this aspect?
Yeah, absolutely. So that's a great question you asked. So, like an example, there are masters, right? We always talk about masters, masters, masters. So, when you do the masters, there are masters with STEM program and non-STEM. So now actually they added pharmaceutics, pharmacology, all of these also into the STEM program. So the beautiful thing about the STEM program is, okay, here is the deal. You do the masters, you automatically are qualified for 1 year of work authorization. So you don't need H1, you don't need anything. 1 year you're legally allowed to work just because you did masters in this country. So you got 1 year. That's for non-STEM people. So mostly chemistry, pharmacology, pharmaceutics, all these things come under STEM program. So when I say STEM program, which means after the 1 year is finished, because you did the masters in STEM program stuff, you will get another 2.5 years of extension for your work authorization. So that makes it almost 3.5 years. So when we say 3.5 years, so you have to apply for H1. Let's say right after the college, you got the job with your work authorization. So you do not have to wait for H1. You can apply for the H1 on the first year through your company. You get a lottery picked, you're good. You did not get picked, no worries, because you still have 2 more years to go with the work authorization given by this country. So then you go for the second year, you apply, and you might get it, you might not get it. So like, third year, you can still apply, and you might get it, you might not get it. And the fourth year, I mean, like you have 3 chances to hit that lottery before you worry about the real H1, because you are automatically eligible for to work in this country without H1 for 3 years. And let's say, God forbid, fourth year you didn't get it. So in that scenario, quite a lot of people, what they do is they enroll in another online college, an online certificate program for 1 year. And then you do that. And then while you're doing that, you're again allowed to work and do the certificate program. And if you're making, probably like an example, like say barely, as a pharmacist, your starting pay is usually $120,000 per year as a pharmacist. But if you're doing for research, public health, or anything, your starting salary would be $80,000. And let's say you have to pay for the college maybe $10,000, and you're still taking home 70. Again, I'm talking about to the math of money and all that, because money plays a big role when you're in a different country where you have to pay your school fee in dollars, not rupees. So that's why I want to compare the consequences of it. But that's where you see, let's say you have to do that, you might do it one more year, and then within that 1 year certificate program, you get you apply for one more H1, and then you might hit it. I know people who had, like, not a lot of people, I know people who had tried it for 5 years and got it in the fifth year. For that reason, after the third year, they had to do 2 more years of certificate program, which they did. And then in the second time, which is the fifth year for them, they got the H1 clicked, and then they're now set. And once H1 is like picked in the lottery, you're good for another 5 years easily. I mean, it starts from 2 years to 5 years, but usually, even if they give it for 1 year, extension is a lot easy. But getting picked the first time is the hardest one. And you have more options. It's not like, one hit and you miss and you have to go back to India. No, you have multiple chances to hit that lottery system.
Okay. Uh, I think this question is already answered, but just for the clarity of the audience, I would like to ask it once again. Is clearing NAPLEX a mandate for working in retail pharmacies?
Yes.
Okay. So after clearing NAPLEX,
Mhm.
the options that you mentioned previously are working in retail pharmacy, working in hospital pharmacy. And in case if somebody is willing to become a clinical pharmacist in a hospital, then
Mhm.
what is the procedure or what is the approach for that?
So there is no legal requirement for a clinical pharmacist. A regular pharmacist, clinical pharmacist, any kind of these specialty pharmacists, it's all the same thing. You have to have an NAPLEX cleared, and then apply for the license. I mean, MPJE, state jurisprudence exam, and then apply for the license, and you get the license, and you can apply for any of these jobs. But it's easier to get a retail pharmacist job. They don't ask for any additional requirements other than the license. But just because there are less hospitals, they tend to ask for, like, oh, do you have residency, stuff like that for hospital. You can become a clinical pharmacist right with the license. But if you want to, but most of the times hospitals tend to ask you if you have residency or not. Once you get the license, you can still do a residency. Residency is still paid. Don't I want to make this clear to you guys. Residency is not something like you have to, it's not like an internship that you're not getting paid. Residency time, you get paid, but only thing is you get paid half. So let's say your pharmacist salary is 100,000 in the hospital, you get paid 50,000. So you can do the residency, and then right after the residency you can be hired as a clinical pharmacist. But of course, once you become the clinical pharmacist, you'll get paid 100,000. And when you're doing the residency, you'll be getting paid half, if it is 50, 48, something like that. But if once you do the residency, it's very easy to get a job in the hospital. But without the residency, it's a little hard, just because of the scarcity of it.
So this residency is completely different from internship. So internship hours don't count.
Correct. Internship is not. Internship is just for the regular pharmacist thing. Residency is very, very specific. Like, it's cardiology pharmacist, or it's like a kidney, what do you call it? Nephrology pharmacist, or what do you call the other ones? Oh shoot, I forgot. Yeah, they're like
Respiratory, something like that.
yeah, respiratory, and then there is infectious disease pharmacist, like that, very specific. So you're just pretty much like an example, just like a doctor. You become a doctor, but you want to become a nephrologist, you have to do another 2-3 years. The same thing with the pharmacy too. You just become a pharmacist with the internship hours, and you want to become a clinical, which means you have to do clinical, like, very specific to the hospital, like nephrology, cardiology, something like that. Cancer, oncology pharmacist, you can become that too.
Uh, any comment that you would like to make on the availability of residency? Is it
Yeah,
easily available residency or
resident residency is hard to get. I'm not gonna lie. I'm not gonna make sugarcoat it. It's hard to get. The reason why it's hard to get is because there are a lot of people in this country with the citizenship or applying for that. So it's hard to get for people, especially when you come here for visa, with visa. And if you have the patience, even honestly, let me make this clear before I say that. It was hard for me to get admission in Farm D, because a lot of people here wants to do Farm D. So it was not easy for me to get the Farm D, but I waited and I got it. So if you want to do it, you can wait and you can get it, but it's not easy because there's a lot of people here applying for the residencies and all that. You can apply and you will get it too, but the only problem is because you have the restrictions of visa, timing, because you only have certain period of time to finish that, it gets hard. But if you have the patience, you can wait for it. Yes, it's easy to get. All you have to do is apply, do their requirements like SOPs and why you want to do it and all that, give the interview, and then if they like it, you get it. But only thing is, with visas and everything that you have, all those restrictions and time being the crucial factor, because if you don't finish that residency and if you don't get the admission within that time period, you have to go back. So that's why it makes it hard.
So again, I think you said in terms of pay, clinical pharmacists are the ones who get 100,000, if I'm not wrong.
Yeah, usually, yeah.
And retail is like 120.
It's the starting, it can go up to 130, 140. Yeah, retail, it can go up. Yeah, same thing, even in clinical too, it will go up too. It starts at 100. I have seen people in retail, in clinical, who make 140, and I have seen in clinical 140, and I also seen in retail people making almost 200. It's limitless, but it just depends on what you pick and where you pick and how much demand is there. Like an example, just the way I said, if you're in a city and there are a lot of people applying for it, you might only get 32 hours, and then your pay will go down too, because there is more supply than demand. If you go a couple hours down, if you go to Alaska, if you go a couple hours away from the city, and there will be less supply and more demand, and in that case your pay goes up, and they might ask you to do overtime. So in America, overtime is 1.5. So let's say you worked Monday to Friday, that's 40 hours. Immediately you go Saturday, you will get paid 1.5 times. So like an example, your hourly pay rate is $50 an hour in clinical pharmacy. So on weekends, they have to pay 1.5. That's $75 an hour. Slowly like that, your pay goes up. But if there is no supply, right? If there is a lot of supply, they would not give you the overtime. They would rather get somebody else and just do the regular hours on the weekends.
Okay. And we have one more person asking you.
Okay, sure. Go ahead, Soumya.
Yes, yes, Soumya here again. So, as many of us are planning for MS in abroad, would you suggest any country and university based on your experience?
Yeah, there are a bunch of universities, Texas, I would not tell you one university, because there's a bunch of universities in this country that are good, and I would
Yeah.
suggest the universities that are, I wouldn't recommend. I will tell you what I don't recommend. That makes it easy. Do not go for cities. Do not go for New York. Do not go for San Francisco. Do not go for Chicago. Do not go for these big cities. Go for smaller ones. Go for like somewhere in Texas, Michigan, somewhere. These places are considered remote. When they are remote, your opportunity levels go up. So when the hospitals need more people, the research there needs more people. When you go to the city, your opportunities go down, because everybody here also wants to be in the cities. Like an example, if you go to Hyderabad, there's a lot of software companies and a lot of people working there. If you come to Guntur, and then if there's only one company there and nobody is there, so they always want to hire anybody that comes from there, just like that. It's more in this country rather than in India, but it's different. But here, the more rural you go, the more pay you get, the more opportunity you get. So that's number one. Avoid the cities. Number two, look at the state universities, like University of Michigan, University of Texas, University of like that, like University of Utah. The state universities are funded by the government. So when they are funded by the government, you have stipends, you have scholarships, you have TAs, PAs, everything. So which would help you to pay off to pay off for your school without you breaking your bank, or without you working on part-time jobs and all that. That's number two. Number three, find the areas. You can actually look into the before even you start the school, or you can go to the consultancies and they will help you too, or you can Google these things too. What is the living expense in the neighborhood? So any university, let's say you picked University of Utah, So University of Utah located in Salt Lake City. So you find out University of what is the expense, living expenses in Salt Lake City. So let's say if it says $500 per month, and now compare it with, I mean, you're going to pick 4 or 5 universities, right? Now compare that with another university. I mean, this is one other university I really like. It's called Lamar University. It's in Texas, and it's very cheap. That's why I like it. So you check out Lamar University, and what is the living expense there? $200. So obviously you're gonna pick Lamar over University of Texas, University of Utah. But let's say your choices right now for the masters you chosen is University of San Francisco and sorry, University of California in San Francisco or University of Utah. So University of California is $2,000 monthly expense, and University of Utah is $500. Obviously, you go with University of Utah like that. So that's what you have to look into. So again, that's why I said I'm not going to give you one university. All 40 people can apply. There's good universities. Always ask your consultant, depending upon the score you get. I mean, any consultancy you go to, depending upon the score you get, tell them the most important thing for you is I do not want to pay for my master's. Teaching assistant, assistantship, or scholarship, stipend. That's the university I want to go to. If your primary goal is that, you're going to have success for it easy. If you go for any university for any big things, I don't think it's worth it because your family is good enough for you to get a job. But for you to save the money when you're doing the master's is more important. Unless you have the money, hey, you know what? I have the money at my home and I don't care much, then go for it. That's a different story. I hope I answered. If you have anything more specific, go ahead, Soumya. I'll try to answer it.
No, sir, it's clear. Thank you.
It's clear. Okay, good, good.
Yeah.
Hello, sir.
Hi there.
I am Rohit, sir, studying fourth Form D.
Mhm.
Sir, I heard that completing NAPLEX isn't so easy, and also have an attempts of 5 only.
Uh-huh.
Can you suggest me? Can you suggest me any other course or job that is relevant to the path we are going in, sir?
Yeah, I mean, yeah, you can get a job in any industry. You can actually come to America and then do your master's in any one particular subject, like even public health, even healthcare administration. You can even do pharmacy communication. You can do any of these masters, and you can become a professor. And professors make good money too. You can become that, or you can do one of these. One of the questions one of these girls asked, and you can become a research R&D, or forget about anything. Just come here and then. Excuse me, and you can become a we can work for the industry in multiple different areas, pharmacovigilance or anything like that, and all of those things pay very well too. And you want to change yourself to software, you can become a SaaS. SaaS is something that a lot of people use in finding the stats of any clinical research performed on any kind of drug. You can do that, and then you can work for industry for a SaaS person too, in software, kind of software and clinical side of it too. Yeah, you can pick one of those two.
Yes, sir. But as you said, as professor or other any courses or the other any professions, it takes some time, no, sir. Uh, After
Yes.
completing of 3 to 4 years in NAPLEX, in preparing NAPLEX and taking it, and if it's not possible, is there any course or any job that is easy to settle, sir?
Yeah. I mean, even if you take, that's what I'm talking about. If NAPLEX, let's say you came here, if you come here for some kind of masters, right? You're not going to come straight for the NAPLEX. You have to come here for any kind of masters. You finish the masters, and let's say you failed on NAPLEX. You tried 5 times and you failed it. I mean, God forbid you won't, and then you pass all of those. But let's say you fail, then you can just still apply. With your or nothing to do with about masters, just with your PharmD degree from India. Just put it on your resume, and you can apply for any of these jobs that I just talked to you about. Any of these jobs at any industry, you can apply.
Okay, sir. Thank you.
No problem.
Hello, sir.
Hi.
Hi. So you mentioned that the universities that we take should be like rural and not in
Preferable.
cities. Yes. So, like, have you ever heard of like university rankings?
Yeah, see, that's exactly what I'm trying to say. It depends on what you want to do. Are you going for that master's to pick a career in that particular master's, then go for the pharmacy school ranking. Like an example, you want to be great in chemistry, you can go for Brown University. They're one of the top Ivy League college, and then you have to pick a career in chemistry. Or let's say if you want to do pharmacology, and you can pick Carnegie Mellon, and then you can go for that, and then you pick a career in that pharmacology right after you finish in pharmacology, right after you finish your master's in pharmacology. But if you want to become a pharmacist, or if you want to change your career, you don't need that ranking and everything. You just need a basic master's just to come to this country, just a path to come to this country. So in that case, it doesn't matter of the ranking. But if you want to go specific about a specific master's and continue the career in that master's, then you have to pick something with the highest ranking, and which you can find in Ivy League schools or any list in Google. It changes every single year from Stanford to every single thing. They change every single year. UCSF is a great college. UCLA, UOP, University of Pacific. These are great colleges. At the same time, they cost a lot too. They are master's programs. Some of them are like almost 50, 60, $80,000 per year.
Yes, sir. Thank you, sir.
Okay, no worries.
So I have another one, the last one probably.
Uh-huh.
So if I come to US with an intention to clear the foreign FPGE,
Mhm.
clear NAPLEX, and want to settle either in retail pharmacy or in clinical pharmacy. So I come to US for a master's program because that is the easiest way for me to come over there. So when exactly should I start my preparation to clear these exams to begin with FPGE? So when exactly should I start with?
I would say start right away. I mean, of course, right now to come to America, you'll be working on TOEFL and all that. So as soon as you get your visa stamped, I would say starting the first day. You don't have to have a work permit to finish these exams. You can start right after right after you get the visa, start studying, and then once you come to America, start applying for the exams, and then start taking it.
And any information that you can provide us for the amount that we need to pay as fee for these exams, FPG and NAPLEX?
Absolutely. It's usually, I mean, of course, every year it changes. I think currently it's about $300 per exam. So NAPLEX is about $300, and MPJE is about $120 or $150. Every state is a little different. That is MPJE. FPGEC is the expensive one. It's about $500 or $600. And before you do the MPJE, of course, TOEFL, I'm sure you can do it in India. It's about $200, I think so, if I'm not wrong. So those are the approximate prices. But again, every year these numbers change. But currently, this is the price that they have.
Okay, I think Navya wants to ask anything.
Sure.
Sir, so you said we have to write TOEFL to clear the license exams.
Yes.
So for masters, do we have to write TOEFL only, or we can write IELTS also?
Yeah, you can write IELTS also.
Okay. So either one is acceptable, right?
Yes, either one is acceptable.
Okay. Thank you.
No problem.
Soumya has something to ask.
So yes, sir. Last one from my side.
No, go ahead.
I heard it's not possible to get visa doing a job different from MS course. Any
No.
comment on it?
No, nothing like that. You can get it, but this is the clarity that you have to get it is you just have to prove them. Let's say, like, you don't even have to prove. Like an example, I'll tell you an example. So let's say you did PharmD, right? You came to America to do masters in information technology. Okay. So now, after you did the master's in information technology or computer science engineering in masters, now you don't have to get a job in the same thing as you get in the masters. It would be easier, but let's say if you get a master after the masters, you got a job in pharmaceutical industry. So it's like a swing, right? You started at pharmacy, did the masters in computers, and now you went back to pharmacy. At that point of time, let's say you apply for visa, you got picked up in the lottery. After you picked up in the lottery, they'll ask you questions. Hey, how come you did your master's in IT and then now you're getting your job in pharmacy? How is this possible? Then your lawyer will draft a letter saying that, hey, you know what, she did her bachelor's in pharmacy, so she has an amazing background of pharmacy. Simple. And he just sends a certificate and they'll be like, okay, cool, that's fine. This is a drastic thing. I'm saying from math to science, like, math to like human sciences. So pharmacy is human sciences and IT is completely math. Even when you do a big transition like that, you can still just send a letter and then they'll usually approve it. But when you say about a master's in public health and you're doing working in industry, this is basic. This is not considered a change of change apart from your master's. This is just a basic. Your, what do you call that? Your area of it's still in the area of your master's. If you just do masters in chemistry, and if you do in industry, if you do your masters in pharmacovigilance, and you're working as a pharmacist, these are not considered far from pharmacy. Unless you go completely drastic. Even then, if your undergrad matches your job, they can still prove it.
Yes, sir.
Go ahead. Did I answer your questions, Soumya?
Yes, sir. Thanks.
Okay, no worries. Okay, Navya, looks like Navya has a question. Go ahead, Navya.
Yes, sir. So you had mentioned SAS programming before.
Yeah.
Yes. So so if we do SAS programming, we will be getting jobs in medical writing or medical coding.
They both. Whichever you get your expertise in, you can get in a job either one.
So like if we learn the SAS programming in India, is it applicable in USA?
Absolutely.
So we can do the SAS programming in India and we can apply for a job visa to the USA.
Yep, you can.
And we can directly apply for jobs based on that.
Yes, you can. If somebody is willing to give you the job, yes.
Okay, thank you.
No,
thank
no
you, sir.
Got it.
Yeah, and sorry, I was trying to extend my question before somebody had a different question.
Oh, sorry. Go ahead.
So previously you said that the fee of NAPLEX depends on the state and the state bodies like that.
Yeah, no, MPJE, not the NAPLEX. NAPLEX is the same. MPJE depends on the state body.
Okay, so is there anything like you have your training or you have your internship in a state and you try to apply for a different state? It's still acceptable?
Yeah, absolutely. Absolutely acceptable. Only thing is you just have to take the different states exam, but your internship hours you do across anywhere you do in America is applicable. Very good question. Let's say you do your internship in California and you want to apply for New York, you can. Your hours will be still valued.
Okay, so which is like 1,000 hours you mentioned, if I'm not wrong.
Yeah, I think 1,000 or 1,500 hours. Last time I checked, it was 1,000 hours. Then I heard somebody saying it bumped up, but I don't know exactly how many.
Okay, so irrespective of wherever you do it, those are still count.
Yes, everything is counted. Yes.
So I think this is it we have for you, sir, and we are very happy that you spared your time for all of us and cleared all of our understanding towards how it is to practice pharmacy in the United States. So we once again, on behalf of our institute, that's Gabriel Hanma Institute of Pharmaceutical Sciences, wholeheartedly thank you for sparing your time, and we hope to continue this association with you in the coming years also. Thank you so much for your time.
No, anytime. Thank you. And I hope I answered your questions. I did not confuse you guys more than, because it is a confusing thing. It is not, because it's not easy. Like you finish something, you apply for a job. We're just trying to find the best loophole to make it easy for anybody to come and then make their life easy without spending a lot of money. That's why it makes it a little confusing. If you have the money and if you have the time and if you have the visa, it's not that hard. It's very easy. But because none of us has that, so that's why it's a little confusing. But I hope I made it a little easy for you guys.
Yes, sir, you did. You did actually made it very, very clear. Thank you so much for that. And we all wish you a great success
Thank you.
Hope some of you, some of our students will find a place in your retail pharmacy soon in your
Oh,
future.
absolutely. More than happy to. You can always reach out to me. I mean, Pramod has my number. You have my number. Yeah, if you guys ever come and if you guys ever need any guidance, any kind of help from me, I can guide you guys for sure. Absolutely.
Okay, then. Thank you, sir. Thank you so much. We would like to end the session.
No, thank you, Raghav. Thank you, everybody, and good luck. Good luck.